With COVID, things had to move primarily online and telehealth. And it sort of begs the question of, is that possible? Is that feasible for a lot of centers to make the shift that might be longer term? So that was kind of the impetus for doing this research and doing this project. People called these centers asking as if they were going to make an appointment and asked several questions about the type of appointment they would be capable of having, what kinds of doctors they would see, the insurance that would be accepted at the various centers. And then we combined that data with what we knew about the centers that they were calling.
COVID-19 really threw a wrench into many practices, as we had to try to figure out how we were going to accommodate our patients' needs, and whether that was moving visits to outlying centers, as we made some centers COVID positive hospitals, or really ramping up telehealth. And I think that across the country, the latter strategy was something that we really moved to. And so what we really wanted to discover was, did different centers have a different capacity of ramping up to telehealth differently? So were big centers, for example, better able to offer telehealth than smaller centers? Were teaching hospitals better able to do that than others? What about population size? And I think what was really gratifying to me was to discover that in general, while on bivariate analysis, it looked like there was a difference in terms of facility type and teaching hospital bed size and so on, making a difference in terms of telehealth capacity. When you controlled for all of those factors, because many of those are, as you might imagine, collinear, there really wasn't a difference. What was different was that there was a geographic disparity.
So our group became interested in who uses telemedicine after we started seeing in clinic. A lot of times, some of our patients would have a really hard time connecting with us, and we would have a failed clinic visit. They'd need to come in to see us in person, and that sort of delayed their ability to come into clinic and see a physician. And so telemedicine has a lot of benefits. You don't have to take a day off work. You don't have to drive 4 hours to come and see us. We're able to get information from you and give information to the patient in a much shorter time frame and without wasting our patient's time. And so we were trying to figure out, like, who are the people that are really benefiting from all the convenience that telemedicine brings. And so we anecdotally noted that there were some patients that seemed to navigate telemedicine better than others. And so that's why we decided to actually do a study to see who really is using telemedicine and who is able to do video-based telemedicine versus audio-based. So we've been doing some qualitative research as well, talking to patients, talking to providers about their experience with telemedicine. For some patients, audio-based telemedicine is sufficient. They're able to get the information they need. They don't need to see their provider's face. But in a lot of situations, video-based telemedicine is much better for many reasons. One is that you get the body language feedback that you look for in an in-person telemedicine visit or in-person clinic visit. I think for a lot of people, that's their biggest concern, is having a telemedicine visit. It seems like it's more distant, it's less personable. I can't really get the intangible quality and communication that you usually get from in-person communication. But with a video-based component, there is some element of that you can read body language, et cetera. For physicians too, they've also described the ability to establish a patient's baseline. So just looking at their home environment, sort of seeing what's going on in the background, getting an overall gauge of their BMI, their functional status. So sort of being able to get a lot more information from a visual, quote, exam than maybe just getting information, giving and receiving information over the phone.